Welcome to Eye Care Associates. You're about to meet a great surgeon, Dr. Paul Hiss. He's amazing.
Today we're doing a spotlight on eye care, and I'm joined by Dr. Paul Hiss of Eye Care Associates. He's one of the country's most experienced cataract surgeons. Now you've got a model of an eye there. Show us and explain the anatomy.
Okay. First off, people mistakenly think that a cataract is a film that grows over the eye and that all we have to do is peel something off the eye. It's a little bit more involved than that. The front of the eye is actually the cornea, and the cornea is not involved with cataract surgery. I'll have to take the eye apart. We don't do this during surgery, but when we take the eye apart, we see that behind the cornea and behind the pupil sits this little disc. This is the lens, and this is what gets cloudy in time.
So Dr. Hiss, what can be done if somebody's had a previous surgery but they've had a bad outcome?
So if a patient has cataract surgery, one of the other limitations of the eye may be keeping them from seeing as well as they thought they would, or as well as their neighbor does. So those other issues need to be addressed to maximize the visual potential in a post-cataract patient.
Well, let me ask you about all the different vision correcting procedures that you do and how you find the right lens for a person.
Well, cataract surgery is the most common vision correcting surgery done in the country, and it's the most common one we do here. Because as we described, everybody will develop a cataract if they live long enough for that natural process to occur. Other surgeries we do laser treatments here, LASIK surgery, PRK. Those are surgeries for people who want to be out of their glasses, but those aren't people with cataracts. And we have special lens implantation surgeries to do on people who are highly nearsighted and they can't have LASIK. We have little lenses to put in the eye without taking out their lens because they don't have a cataract yet. But with cataract surgery, the choice comes down to what does the patient want to achieve with their vision after cataract surgery. Would they like to see far away as good as possible so they can drive without glasses? In which case, as you know, an adult would wear reading glasses if they had good distance vision. Sometimes people want to be nearsighted. They have their nose in the books all day long, they do crosswords, or they're an accountant, and they want to be able to do those close things without glasses. We can keep them nearsighted with the lens implant we choose. In which case, they would need glasses to see at a distance. They'd have to drive with glasses. Nowadays, though, there are some newer lenses that have been developed that have both far and near vision. Those are bifocal or multifocal lens implants, and some patients may choose that lens if they want to be as independent of glasses as possible after cataract surgery.
I think that Dr. Hiss is wonderful. He did a great job. He comes in and tells you what he's going to do, and it's very relaxing, and he just knows what he's doing and makes you feel like you're getting the best treatment that you can get.
And to be able to see the mountains, and they're so clear, and the brightness, it's been a great experience.
Dr. Hiss is just, to me, he's wonderful. He gave me my sight. I mean, that's a blessing.
Optometrist Dr. Doug DeVries has worked with Dr. Hiss for over 20 years.
Our patients are referred to us by friends, family, former patients, as well as local area optometrists. As well, we travel to Ely, Elko, Winnemucca, and Fallon to perform surgical services, which is quite unique for somebody in that area to be actually operated on by a world-class surgeon such as Dr. Hiss.
I've been here 6 years, and I love working for Dr. Hiss because he's an excellent surgeon.
I'm a technician, and I work with Dr. Hiss, and I see the patients prior to the surgery and after the surgery. And I've worked here for 19 years, and his outcomes are absolutely amazing. And the reason I've never left is because I know I couldn't convey, if I work for somebody else, that they're getting the best, because Dr. Hiss is the best.
After seeing Eye Care Associates facility and getting to know Dr. Hiss and his surgical team, they do remarkable work here. Dr. Hiss will be the first person I call when the inevitable happens and I need cataract surgery. If you'd like more information, you can find it online at Dr. Hiss, that's drhiss.com, or call Eye Care Associates of Nevada in Sparks at 674-1100.